Hey, here are 20 interesting facts about blood pressure and hypertension. 1. Did you know that blood pressure was first measured when a glass tube was inserted into the artery of a mare? The tube subsequently filled with blood, which rose and fell with every horsey heartbeat. 2. Even your blood pressure changes with every heartbeat, which is why there's 2 blood pressure readings. 3. The higher one, or systolic pressure, is the pressure in your arteries when the heart beats, and the lower one, or diastolic blood pressure, is the pressure in the arteries between heartbeats. 4. A healthy resting blood pressure is 120/80 or lower, but not 0/0. That means blood ain't flowing, so you ain't going, except maybe to the morgue. 5. When your heart is working harder, like during exercise, your blood pressure increases. For example, systolic blood pressure can temporarily reach over 300 during maximal arm curls. 6. But your blood pressure is not just based on the workings of the heart, but on how accommodating the blood vessels are to receiving blood from the heart. 7. Things like muscle contraction and stress can narrow your blood vessels, which increases the resistance of blood flow through the arteries and therefore increases the pressure inside them. 8. Also, eating too much salt drives up blood pressure when extra water is pulled into the blood to dilute the salt. This is why a diuretic or water pill can help lower blood pressure, but ruin road trips. 9. A temporary increase in blood pressure, like during exercise, is okay and necessary to push all the extra blood to the working muscles. 10. But a permanently elevated blood pressure, known as hypertension, is a major risk factor for heart disease and also contributes to strokes, vision loss, kidney disease, and sexual dysfunction. 11. Hypertension puts an extra strain on your heart, as it continually has to work harder to pump blood into the high resistance of the arteries. 12. It also damages the lining of the blood vessels, laying the groundwork for atherosclerosis, which can seriously block blood flow to your heart, brain, eyes, and kidneys. Stage 1 hypertension begins with a resting blood pressure of 130/90 and changes to stage 2 with a reading of 140/90 or higher. 14. It should be noted that a single blood pressure above these ranges does not reflect your average blood pressure throughout the day. For example, some people demonstrate what's called white coat hypertension, a higher blood pressure reading in the doctor's office than throughout the rest of the day. 15. So it's critical to measure your blood pressure at different times throughout the day, while you're quietly seated with your back supported, feet on the floor, and your bladder empty. 16. Not doing so can give you a 5 to 30 point higher systolic blood pressure reading. 17. It's important to remember that you can't feel high blood pressure. It can be high even when you feel relaxed, which is why hypertension is referred to as a silent killer. 18. Unmodifiable risk factors for hypertension include race, age, and family history, and sometimes family gatherings. 19. But everyone can lower the risk for hypertension by not smoking, maintaining a healthy weight, eating a healthy diet, limiting alcohol, managing stress, and being physically active, even lifting weights. And 20. If you are diagnosed with hypertension, continue to do those things. But in order to bring your blood pressure under control, you may need medication, which can be very effective and better than a heart attack. Thanks for listening. Post any questions you have in the comments section and check out my other fitness facts videos. As always, my answers come from peer-reviewed research.